To begin with, what are enzymes? Well, enzymes are biological catalyzers of protein nature that lower the activation energy and accelerate the reaction velocity, acting on the substrate, which is converted into the desired product. They are highly specific with their substrate and active site. Also, they are of great importance and we can find them in multiple metabolic reactions in living organisms, like digestion, cellular respiration, glycolysis, among many others. Without enzyme cycles or metabolic pathways wouldn't be possible, leaving missing products for further reactions. On the other hand, there are certain enzymatic inhibitors that reduce or stop catalytic enzyme activity by blocking or deforming the enzyme's active site. Within the inhibitors, there are different types of inhibition depending on their effect on the enzyme. This can be competitive, non-competitive, uncompetitive, and mixed. Enzymatic inhibitors have been of great importance in the pharmaceutical drugs industry, such as aspirin, atorvastatin, antimitotics, etc. To give a more detailed explanation on how the active compound of drugs modifies the enzyme activity and how this affects the general functions of an organism, treating or decreasing the symptoms from a disease, I'm going to explain two different medicines commonly used in the drug industry. One of them is warfarin, an anticoagulant that acts as a competitive inhibitor of the vitamin K epoxide reductase. Vitamins are cofactors required for the stimulation or maintenance of normal metabolism. By inhibiting the vitamin, it stops the production of coagulating factors, therefore acting as an anticoagulant. Another very simple example is sildenafil, or commonly known as Viagra. This is a non-competitive inhibitor that binds to the allosteric site, deforming the active site, and preventing the substrate to bind to the enzyme. The enzyme that it acts on is the phosphodiesterase type 5, in charge of vasoconstriction. As a result from the enzyme inhibition, there is a vasodilation in the organism, triggering or causing an erection. There are different advantages to using enzymes as therapy for diseases rather than the use of traditional pharmacological drugs. Actually, it has been one of the main focuses on the medical industries for decades, as it has shown promising therapeutic effects for various pathologies associated with poor or deficient enzymatic activity, going from metabolic deficiencies to cardiovascular diseases or cancer. Diseases that in the past were difficult to treat can now be treated with enzyme replacement via targeted delivery. In this way, the catalytic activity of enzymes can convert various target molecules to reestablish the correct physiological metabolism. In comparison to traditional pharmaceutical drugs, biopharmaceuticals offer advantages like high substrate specificity and affinity, minimal side effects, low toxicity, and efficient catalysis, which allows for the administration of lower quantities of drugs.